Going?
Right.
All right. Hi, Kate Lisk. I'm doing the HEENT and Neuro Assessment. We're going to start. Hi, my name is Kate Lisk. I'm a student nurse here at Southwest Tech, and I'll be working with you today. Provide privacy by drawing the curtain and perform hand hygiene. Could you just tell me your first and last name and your date of birth?
Yeah, Trinity Goldbaum, 10/15/99.
Okay, I'm just gonna check your ID band here. And Trinity, do you have any allergies? No? Okay. All right, so I'm going to gather my necessary equipment here, and I'm gonna sanitize my pen light. It's about really the only equipment to sanitize. I will be wearing PPE gloves later on during the assessment, but currently they're not necessary. I'm gonna throw this away. Okay, all right, so I'm gonna take a look at our provider orders here, and it looks like we have you in for a basic neurological assessment. I'm sorry, I think I said neurovascular earlier, it's neurological. So I'm gonna be checking your head, ears, eyes, nose, and throat, and asking you a few questions, and just feeling around on some of those, okay? Do you have any questions before we begin?
No.
Okay, and are you in a comfortable position there?
Yep.
All right, sounds good. Okay, so I'm gonna start with the neuro assessment, so I'm just gonna ask you a few questions. First, I'm gonna say 3 words, blue sock bed. Can you repeat those back to me?
Yeah, blue sock bed.
Okay, very good. All right, and can you tell me your name again?
Yeah, Trinity.
Okay, and do you know where you are?
Yep, skills class.
All right, and do you know why you're here?
A neuro assessment,
Okay, and do you know approximately what time of day it is?
like 1 o'clock.
Okay, all right, sounds good. Okay, and could you tell me like the name of your first pet?
Smoky.
Okay, all right, and we're gonna take a look at your head here. So I'm just inspecting your head for shape, size, and symmetry. Everything looks good there. And I'm just gonna palpate, I'm just gonna feel around on the top of your head, just checking for any masses. All right, and any tenderness there with any of that? No? Okay, and do you remember those 3 words I had you say earlier?
Yeah, sock bed.
Okay, very good. All right, and then could you just move your jaw back and forth like this? Okay, all right, looks good. Okay, so moving on to your eyes. Oh, no, I'm sorry. One more thing I forgot. All right, so we're going to check for touch. If I could have you just close your eyes, and then I'm gonna just lightly touch the side of your face. If you could just tell me every time you feel it.
Yep. 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 Yep.
Okay, all right, good there. All right, okay, and then we're going to move on to the eyes. I'm just taking a look at your eyes, checking the iris and the pupil for color, shape, and symmetry. Everything looks good there. If I could have you close your eyes for me, I'm gonna check your eyelids, checking for edema, lid lag, and any lesions. Looks good there. You can go ahead and open your eyes. Okay, and then I'm gonna check your conjunctiva. If I could have you just pull down your eyelids just like that, just checking for color and moisture, and that looks good there. So I'm gonna move over to the side of you here, and I'm going to, oh, sorry, I'm right in the camera's way. All right, and I'm gonna shine the light in the side there, just checking the lens and the cornea, checking for color and lesions, and that looks good there. Trying to think if I missed anything earlier. Okay, I am gonna have you check, I'm gonna have you watch the tip of my pen light, okay? And so I'm gonna move this in towards you in a way, and just moving your eyes, you can follow it, okay? All right, so that is pupillary accommodation, so that all looks good. And I'm not sure, no, that doesn't do it. I'm gonna dim the lights. I think all of you. Okay, really dim them. All right, and you can just look forward. I'm gonna check for your pupillary reaction. All right, one more time. Sorry about that. And that all looks really good as well. we're going to do the 6 cardinal gazes. So if you could just watch my fingertip, and without moving your head, just your eyes, if you could follow my finger, okay? So we're gonna do 1, 2, 3, 4, 5, 6. All right, and that was a great job there. That all looks good. And then now I'm just gonna feel your ocular globes. So I'm just gonna palpate around here. Any tenderness with any of that? No? Okay. All right. Okay, and one thing I did forget to ask you earlier, I'm so sorry about that. With the HEENT assessment, I'm also going to check your expression and your face so everything looks symmetrical. And if you could smile for me, everything is symmetrical, so that looks good. And back to the eyes, we did the palpation, did the iris, cornea, and lens. I think I got everything on the eyes. Okay, so we are going to move on to the ears. Our otoscope is all the way over on the wall. I just realized, but that's okay. I guess maybe we can go over and stand over there. Sorry, just realized that. So the first thing that I'm gonna do is I am just going to take a look. I'm gonna tuck your hair behind your ears. Sorry about that. And I'm looking, inspecting on the outside, looking for color, shape, symmetry, looking for any cerumen. The skin looks healthy. It's not too dry. I don't see any foreign bodies in there. And then I am going to palpate. So I'm going to move your pillow forward. And I'm going to press on the tragus. And then just going to palpate back here on, oh my gosh, I'm blanking on your, okay, I'm gonna say give me a second because it might come back to me. Your mastoid process behind your ears. Okay, I'm so sorry about that. All right, and so then I'm going to inspect your middle ear with the otoscope here. Just making sure that that works. Okay, and as we do this on an adult, we would pull the pinna up and back. If we were doing a child, we would pull the pinna down and back. So I'm just gonna pull up here and take a look in there. All right, and I am checking for cerumen, foreign bodies, redness or swelling. Okay, and I'm gonna do your other ear here. Again, up and back. And everything looks healthy there. And the tympanic membrane is a nice pearly gray. And the tympanic membrane is also flat, so that looks healthy. Okay, we can go back over to the face. Okay, and then I'm just gonna do a whisper test on you. So I'm gonna move behind you. I'm gonna whisper three words in each ear and just have you repeat them back to me, okay?
A, B, C. 1, 2, 3.
All right, very good. Okay, so got the ears. All right, so now we're going to move on to the nose. So I am taking a look at the nose, just the external structure for color and shape, and it is midline. I don't notice any drainage. I don't notice any deviations. So I'm going to do an inspection. If I could have you just pull the tip of your nose up. All right, again, color looks good. I don't notice any deviations, no polyps. The color looks good. Moisture is okay. No drainage. All right, I think that's everything on the internal structure and then the nose. So I'm just gonna feel here the external. All right, everything looks good with that. Any tenderness at all with that? Okay, and again, no deviation or deformities. I'm going to palpate on your sinuses. So we've got your maxillary and frontal sinuses. So frontal sinuses here and maxillary on the cheeks. Any tenderness or pressure with any of that? Nope, okay. All right, so everything looks good with that. And now I'm gonna do just a smell test. If I could just have you close your eyes. All right, and I'm gonna introduce something under your nose and you tell me what you smell.
Maybe lavender.
Yep, very good. All right, so we've got that. Okay, so we've got the nose. One thing I forgot to also have you do when we did the eyes, I'm so sorry. I need to just check your up close reading. Can you just read this, either the first or second line there for me?
Active ingredient.
Okay, very good. All right, thank you. And so we've got your nose, and then we're gonna do the throat. So just in looking at your throat, everything looks symmetrical. I'm just gonna run along your trachea here and check. Trachea is nice and midline. Okay, and your mouth. We're gonna check the lips for color, moisture. They're not cracked, and I don't notice any lesions. I am going to put on gloves at this time. All right, so if I could just have you stick out your tongue. All right, checking for color, moisture, and it's nice and midline, so good there. You can put your tongue to the roof of your mouth like this. Okay, checking the floor of the mouth. Color looks good there. And if I could have you stick out your tongue and say, ah. All right, and I'm just gonna depress a little bit. Okay, checking for the tonsils. The size looks good, no signs of exudate. The uvula is freely moving and looks healthy. If you want to open up, I'm just gonna check your hard and soft palate. All right, that is intact. We aren't going to check the gag reflex today, but if we were going to, I would move the tongue depressor back a little further in her mouth, check the gag reflex, and we're not going to palpate the hard and soft palate, but if we were, I would use one gloved finger along the hard palate, which is behind the teeth, on the roof of the mouth, and then move further back to the soft palate. If I was doing that on a neonate, I would use a gloved pinky to palpate, and we're checking to make sure that the palate is intact. I just need to check your gum line, so if I could have you just pull your gum line down. Okay, looks good, and we're checking for bleeding, edema, color, and retractions. Didn't notice any of that. And then if you could just do it with the upper lip as well. Okay, and that all looks really good. So I'm gonna get rid of the gloves here. Oh, one last thing. If I could have, I'm gonna check your buccal mucosa, which is the inside of your cheek. So with your own finger, if you could just pull your cheek out. All right, color and moisture looks great in there. All right, so everything looks good with the mouth. Oh, and then if I could just have you say like tight dynamite.
Like tight dynamite.
Okay, very good. All right, and now just moving on to finish the neck. We're gonna do the your 10 lymph nodes. Okay, so I'm just gonna feel lightly, and I'll list them off as we go. So here we've got the pre-auricular right here in front of the ears. We've got your posterior auricular behind the ears here. We've got the tonsillar, kind of at the corner of the jawline, and then we have your submandibular near the middle of the jaw here, and then your submental, the tip of the chin here. Okay, and then we've got your occipital at the back of your head here, or I'm sorry, the base of your skull. Okay, and then I'm going to do, it's your superficial anterior cervical down here, so I'm just going to feel lightly down your sternocleidomastoid here. All right, and then I'm gonna have you turn your head one way or the other, it's up to you. And I'm gonna go a little bit deeper here, and this is the deep cervical. All right, and I don't feel anything there. If you want to turn the other way, okay, again, deep cervical. All right, and you can turn your head back toward the middle, and now I'm going to do your posterior cervical, so kind of down the back of your neck here. All right, and then I'm gonna do your supraclavicular, so your clavicle's right here. All right, and that concludes the assessment on hand hygiene. All right, so I thank you for your time. While I'm still in the room, is there anything I can do for you? I have time? No? Okay. All right, so I'm going to gather and cleanse my equipment. All right, I'll throw these things away. And for hand hygiene, I would document my findings, and if there were any deviations or abnormalities, I would report them, document them per my agency policy. I'm going to make sure the bed is low and locked, the side rails are secured, call light is within reach, as well as the bedside table. All right, and I would upload all of this into Schoology and calling it.